Hello, everyone, and welcome to the Bio Live webinar. I'm Eugene from Bio, and I will be your moderator today. So this webinar is specially organized for ASC Plus IRLV, and we are excited to share valuable insight with you. Today, we will explore how to enhance your practice with ASC Plus IRLV, and we have invited exceptional speakers who will share their expertise and insights on how they incorporate IRLV into their practice. So our speakers include Dr. Rashad, gynecologist from Dubai, Dr. Elina, dermatologist from Greece, and Dr. Grace, gynecologist from Taiwan. But unfortunately, due to scheduling constraints, Mr. Zhou cannot join the webinar this time. And each speaker will present from around 20 minutes, followed by a 5 minutes Q&A session. So you can submit your questions by scanning the QR code displayed on the screen. We will also share a link in the chat throughout the webinar, so feel free to use that as well. During the Q&A sessions, I will forward your submitted questions to each speaker. Okay, so let's begin with our first speaker, Dr. Rashad, a gynecologist from Dubai. And Dr. Rashad, please feel free to share your slides.
Thank you very much, Eugene, for the introduction. Thank you for hosting this webinar. I think after MCAS, I was with Dr. Elina and other colleagues presenting the exosome revolution, especially we talk about skin, hair, and intimate area. And I think this idea about sharing in a wider range the information about exosome in aesthetic in general and in cosmetic and functional gynecology in particular, where science meets innovation. I am Rashad Haddad, French board OBGYN, practicing mainly in Dubai. Still, I have my practice in Paris and visitor to Riyadh, and I preside in Europe the World Academy of Regenerative and Aesthetic Gynecology, and we have on the same time the American Urology and Gynecology Society based in USA and have the World Conference next April. So before starting about talking about exosome, let's have a small introduction. What are exosomes? Exosomes are transforming in reality in our practice the gynecology through regenerative medicine. Exosomes offer tissue regeneration as well as rejuvenation, and the application of those exosomes are including vaginal health, atrophy treatment, wound healing with a very high purity and standardization, and we have a lot of clinical proof and effectiveness. So let's have certain definition about exosome. Exosomes are nano-sized vesicles measuring between 30 to 200 nanometer produced by the endoplasmic reticulum of the cells. Those exosomes with the average of 100 nanometer are not a living cells, yet they follow specific inflammation signals selectively. Means there is an inflammatory signals, they follow it, and they transmit the message how to repair it. Exosomes are very high rich in anti-inflammatory cytokines, regenerative material like growth factor, protein, and amino acid, and one of the main factors is the microRNA. Those exosomes will be the communicator. It's the cell-to-cell communication between average 200 type of cells in the human body. The most important mechanism of cell-to-cell communication between those cells is delivering protein, nucleic acid, and others. Those exosomes are, let's call them the ambassador of cells for cell-free therapy, and they serve at the same time as key mediator of the paracrine effects performed by stem cells for regenerative purposes. It will promote collagen, elastin, and angiogenesis. And we can use for various medical aspects, including skin, hair, intimate area, as well other application. And surely in the future, more and more application and indication will happen. This picture I will show you only here in the middle, where exosome is, which we said average is 100 nanometer. So it's roughly the same size of a virus, much more smaller than a bacteria and a little bit bigger than an antibody. What are the components of a single exosome derived from adipose tissue? Growth factor. There is around 50 growth factor combined with three kinds of anti-inflammatory cytokines, which is effective for inflammatory disease such as atopic dermatitis, or when we talk in intimate area, one of the dilemma of treatment is lichen sclerosis. There is 598 microRNA, 96 are closely related to skin rejuvenative, and 200 protein for skin regeneration. What are the components of exosome? We just see the microRNA, the 598, 373 kind of lipid, more than 1,000 kind of protein and growth factor inside this minimal vesicles, which is the ambassador from cell to cell. Now, okay, we are all using other ways and other ways in regenerative medicine. What are the advantages of exosome versus other regenerative molecule? First of all is facilitating cellular uptake, high cellular biocompatibility, high safety profile with very low toxicity, much higher potency than mature stem cells, very high affinity and selectively to target cells due to the just factor that we just talked about it. More anti-inflammatory, immune modulation, and regenerative action with anti-aging, readily uptake and absorbed by target cells, programmable to be a drug delivery vehicle. So in the future, we will not only based on the function that the exosome has already as anti-inflammatory or regenerative factor, we can use it as a diagnostic vehicle or drug delivery way to treat certain disease or certain situation or syndrome. Of course, because of this minimal effect, because all of the components that we just talked about it will last longer and more effect than if we compare it with PRP or other collagen stimulator. There is, of course, no risk of over proliferation of or rejection because it's cell to cell and it's targeted. There is a mission for each kind of inflammation or disease. We just talk about the advantages. Let's talk about the challenges that we have, because every time we have advantages, on the other side of the coin, there is challenges. So the main challenges when using exosome is the high heat sensitive. It's non-stable and require a special storage condition that we will talk later about it. There is narrow window of time to use after activation, high cost compared to other stem cells derivative, new technology with limited clinical data on hand. Patients still don't know about it, and the regulatory challenges facing derivative of human origin in many parts of the world. A presence of non-exosome and labeled as exosome, that's another challenge on the end user as a doctor, scientist, or even the patient. Just a quick revision, what are the steps to prepare a exosome? There is the stem cells culture, where we can get conditioned media. Then third, we isolate the exosome, and then we prepare the characterized exosome that we need. Usually, we can have three categories of product: the conditioned media, where there is some exosome with a lot of cellular waste, antibiotics, and debris; conditioned media with high concentration exosome, which is another level, where there is all the other debris and medium and waste, but there is more exosome; and the real one, where the isolated exosome are pure and there is no other product inside. So, there is 9 questions to ask myself before using any exosomes. What is the good manufacturing practice? Where the investment is? Is it in research and development, manufacturing, science, in publication, patency, efficacy, and safety? What are the source? Is it derived from which type of stem cells? The purity of exosome, stability, where lyophilization it's happen, and registration and legal issue. Lyophilization, it's a game changing, because usually the exosome are stored to around -80 degrees. So the application of exosome, it's a big challenge in medical field to transport, use, and store exosome in -80 is not a easy facilities, and we cannot have it in any clinic. So lyophilization is a promising storage method and game changer that can be used to preserve various substances at room temperature, where there is multiple study that we can have the exosome lyophilized, we can have it in the clinic, and the easy to store, easy to use later. The main 3 paradigm for exosomes are the anti-aging action, the rejuvenation one, and of course the anti-inflammatory. And all of them, anti-inflammatory and rejuvenative and anti-aging, are overlapping. We cannot separate one separate from the other. Let's go back to our subject of today, how we can use exosome in aesthetic and medical gynecology. In aesthetic indication, we can have vaginal rejuvenation, where it improves elasticity, tone, and appearance. Post-surgical healing, enhance recovery, reduces scarring after labioplasty, vaginoplasty, perineoplasty. It may correct a big challenge in aesthetic, where there is the pigmentation of the vulva. It will reduce the hyperpigmentation because it will enhance the skin structure and the skin tone, and preventive of all those degradation by maintaining hydrating and tissue health. While in the medical part, we can use it in postpartum recovery to repair tissue damage due to improved laxity, stress urinary incontinence, because as it stimulates collagen, it will enhance and strengthen the anterior vaginal wall. And by this, it will again be a very good therapeutic factor against atrophy and dryness, knowing that 2/3 of the patient coming to a gynae clinic complaining directly or indirectly for the main reason is vaginal atrophy or the sequelae of it. We can use it for ulceration and chronic wound. Lichen sclerosis, vulvar dermatosis is a main indication for the use of exosome, and we have many paper. My experience, the experience of other colleagues show its effectiveness. Sexual dysfunction, hormonal balance sequelae like vaginal atrophy and the symptom of it is highly good addressed by the exosome. There is third chapter, which combination effect. So it's the exosome, we can act as adjunct to laser, radiofrequency, PRP. It promotes faster healing and better outcome and could be highly effective therapy, providing regenerative and anti-inflammatory benefit across wide range of indication. What is the mechanism of action of exosome? It will stimulate fibroblasts, so more collagen and elastin, provide growth factor for natural healing, promote angiogenesis, provide anti-inflammatory and antioxidant, regulate vaginal pH, and there is multi-phaser action to enhance the vaginal situation from anti-inflammatory and rejuvenative effect. We will have, with the few minutes that I still have, certain clinical cases in our clinic that using intimate care lyophilized exosome by Rosa Damasceno. First case, it's the patient came with severe pain, burning sensation, and ulcer-like lesion because she used imiquimod to treat a furuncle after the advice of her friend. We apply pure and solo therapy of exosome IRLV on the lesion, and next day pain and itching were reduced by 80%, and 6 days later there is complete clinical healing and complete absence of the symptoms. The other case, she has multiple superficial mucosal tear and cuts after a sexual intercourse. Lesion were 1 to 3 centimeter distant from the urethral orifice, and there was mild bleeding. So suturing of those multiple lesions was not feasible because the scarring later may lead to dyspareunia, and it may be really difficult to treat later. So we opt for the treatment of exosome IRLV. We apply it with superficial injection after disinfection. It was one dose therapy, and this is the result on the next day by a selfie sent by the patient herself. And this is the final results after 5 days after a single solo therapy, no other method of energy-based device or other product was used to it. This is the final result. And the third case was lichen sclerosis confirmed by histopathology on June 2024. This patient is not a resident in the country, so she is like a tourist. We used one dose of IRLV, and this is the clinical result in September, and this is the final result in December after one dose of IRLV. So if you notice, we selected 3 distinct pathology to evaluate the effectiveness of solo treatment by exosome intimate IRLV. Success with those results that we get treating this condition, it will demonstrate that treatment border applicability for other less severe or more common case, or even though aesthetic, including post-operative care or any regenerative application, it will be feasible, because if we get those amazing results with those rare pathology, What about more common problem or for aesthetic reason? In progress, we are investigating with a group of doctors in the United Arab Emirates the effect of exosome during peri-surgical and post-surgical phases, emphasizing their anti-inflammatory, soothing, pain relief, anti-edema, and healing promoting effect. Exocombio-exosomes mark a groundbreaking advancement in gynecology. They are safe, effective, minimally invasive, and they provide a new hope for vaginal health and regenerative gynecology. We warmly welcome participants from across the globe to collaborate in establish clinical guidelines and the protocol for exosome use in functional and aesthetic gynae, infertility, human sexual disorder. Those three subchapters are very important, and this initiative includes multi-center study for each indication, complemented by comprehensive follow-up protocol. Thank you for your attention, for your time. Please don't hesitate to contact me or contact Exocobio if you are interested to be part of the study. Thank you very much. Thank you, Eugene.
Thank you, Dr. Rashad, for your insightful and informative lecture. So we have a few questions from the audience for you. The first question is, what diagnostic method do you use before exosome treatment?
Diagnostic method, it depends, of course, on the pathology. For example, you notice the first two cases, there is no diagnostic. There is first cases where there is ulceration, there was the pain and the burning sensation. So we have to treat it. And for me, this is very important. The second one was wound. And wound, there is no diagnostic, but we have to choose something that has less sequelae. And the healing was amazing. The third one, where there is lichen sclerosis, we did have biopsy, prove the pathology, and we get the appropriate treatment for it, in my opinion. Second question.
So the second question is, how long does the effect last after the procedure?
The first two cases where there was acute situation and rare situation, the effectiveness till now, they are our patient, they are followed in the clinic. There is no relapse. And as you noted, the third patient, after 6 months, still she is doing well, noticing that we have done only one dose of therapy for lichen sclerosis. And more study, I will surely update you in the coming teaching session or intellectual exchange of experience sessions in the future.
Okay, so the last question is, can it get good results without medication, only using microneedling and exosomes? What do you think?
Very good question, because now you are proposing three kind of method: the pharmaceutical treatment, the energy-based with, you said, radiofrequency microneedling or microneedling alone, or solo. For us to measure the effectiveness of Exocobio IRLV, we choose to use the solo therapy, because when we will discuss scientifically, you can easily question, is it the effectiveness of this exosome or the technology you use or the pharmaceutical? So if we are doing a study, I prefer to use solo therapy. Microneedling alone is a part of the indication. If we are treating a situation, a patient, I think, depends the situation, we can combine it with laser, microneedling, radiofrequency. Why not? And in certain pathology, surely we need a pharmaceutical treatment. But those are proof that even this method of treatment is not because it's an added therapy, it's a solo therapy. We can get results if we want to heal, and there is any indication for other technology or pharmaceutical product, why not we can use.
Okay. Thank you, Dr. Rashad. Please feel
You are
free
welcome.
to leave the webinar if you have any other schedule.
No, my
So,
schedule is closed because I will benefit from my colleagues. I am looking forward.
okay, great. So,
Thank you.
moving on, our next speaker is Dr. Elina, a dermatologist from Greece. And Dr. Elina, please share your slides.
Hello, everyone. How are you? I'm Dr. Elina Theodorakopoulou, dermatologist, and I'm delighted to be here with you among you so that we can speak about intimate care, intimate wellness, and a new novel product for the intimate wellness. And this is IRLV. A little bit about me. I'm a dermatologist licensed to practice both in Greece and Dubai. And I'm happy to have both clinics in one in Greece and one in Dubai. And I'm fully regenerative. I prefer mainly regenerative treatments for the skin, for the intimate area, for the body and the hair. So today I'm very happy because we are touching a subject that as women and as doctors, we don't discuss with our patients. Either we're dermatologists and we are into skin, either we are GPs, either we're gynecologists. And this is the intimate care, intimate wellness in all ages, and particularly in the age that we're getting older, in peri and postmenopause. And why is that? And we have all these beautiful surveys and these beautiful studies all over the world that they show us that there are significant symptoms that they happen to those women as we're getting older. And this can start from the early ages, the age of 38. And this is vaginal dryness, dyspareunia, irritation, itching, all these things that they can affect the women's lifestyle and self-perspective and psychosocial also background. And this is a very nice slide here to show that the vulvovaginal atrophy, this is what happens as those symptoms, they build up in the perimenopause area and as we reach menopause. So what happened is that this vaginal dryness, dyspareunia, and vaginal itching is all over the globe. And what those women experience, the first symptoms here, according to this beautiful global study and survey all over the world, is that the first thing that happens is irritation in the intimate area and itching that usually as women we don't discuss with our providers, or perhaps our providers, they don't understand, they think that there is a bacterial or like a fungus infection, so they give us medicated things. And then of course the last symptom is sexual dyspareunia and sexual and vaginal dryness. So vaginal dryness, just to make sure that you understand, it always comes as a last symptom. First symptoms that we need to hear and listen to our patients is the itching and the irritation. And this can happen as early as 10 years earlier. And because I'm not a gynecologist and perhaps I'm not seeing the vaginal canal and the vaginal every day, I just thought that it's very beautiful to see what happens as we're getting older in the intimate area. So there is atrophy in the area, there is loss of adipose tissue, there is loss of volume in the vulvar tissue, in the labia minora, in the labia majora. There is also a pale texture and atrophic and pale vaginal mucosa over there that we can see that it's easily disrupted when there is intercourse or even, for example, application in that area. So all these things that we can see in this slide, they're important of us to understand when we're talking about vulvovaginal atrophy so that we can help those women. And of course, this is another beautiful slide that shows what happens under the microscope. And we can see here an old and a young vaginal canal. And what we see here is that the old vagina, what it looks like a desert. It's like the same like the skin. So we have minimal squamous epithelial that it's almost with minimal cellularity. And at the same time in the dermis, we see minimal collagen and elastin and minimal vascularity compared to what happens in the young vagina. So old vagina looks like a desert compared to the young vagina that is flourishing, is beautiful, is like a flower. And then another picture to see how important is the estrogen effect on our vaginal epithelium. So when we see that when there is a high estrogen environment, we can have a younger vagina compared to a low estrogen environment, that it's very minimal, the cellularity in the collagen and elastin in that vaginal canal. And apart from the changes that we see, the atrophy of the mucosa, the atrophy of the area, the itching and the irritation, we need to take into account the fact that there is also the microflora that is changing, and it adds to the symptoms of those women. So we see that there is more microbial diversity that can result in what we say bacterial vaginosis. And this is important to know. As we're getting older, we have more bacteria in that area compared to the lactobacillus, that they are there to help the epithelium. And this is another study that shows that how we discuss as providers and we initiate the discussion with our patients. And it's sad here to mention that according to this beautiful study, the providers, us healthcare providers, we don't initiate the discussion with those women that they're getting older. It's the women that they initiate the discussion. We prefer when we see a woman over the age of 50, over the age of 45, to say that your symptoms, whatever you experience, perhaps is due to the result of depression. So we start them on antidepressants instead of discussing with them potential symptoms that with easy ways they can be resolved. And it's a functional way. It's a hormonal imbalance that results to this deterioration of the intimate wellness. What are the current options that we have and we can offer to those patients? And these are minimal: lifestyle changes, physiotherapy, hormonal replacements, which is important, medications, and surgery. But another beautiful study that shows that even with this minimal option of treatments, those women, when they get a treatment for the intimate wellness, when they improve the intimate care on that age, they feel more self-conscious, more self-confident. They improve the psychosocial impact that they have. They become more confident about themselves. We improve the quality of life of those women. And that's very important. We need to treat, we need to know how to treat with, of course, less side effects. What about hormonal replacements? We have already understood that estrogen replacement is very important for the wellness of the area. But again, according to the studies that we have, as providers, we are reluctant to give those estrogen. And also, our patients are reluctant to receive. Why? Because there is a little bit of haziness in the literature with regards to malignancy or with regards to the side effects that they can get from the estrogen replacement. So, of course, perhaps we have a potential treatment, but perhaps with many side effects. So what we can do, actually, and what's new? Is there anything new that with minimal side effects, just a topical application, we can help significantly the wellness of those patients, of us? And of course, it's called IRLV. From ExocoBio. It comes in 2 vials, one vial with lyophilized exosomes from Rosa damascena stem cells, and the other vial with particular diluent that stimulates the microenvironment of our own exosomes. It has growth factors, peptides, vitamins, minerals, non-cross-linked hyaluronic acids, and peptides, important when they are combined with the exosomes to have in just one vial a mixture of 2.5 ml that is important for the improvement of the microenvironment of the intimate area. And what can IRLV do? Do we have in vitro data from ExocoBio out there from their patents that it can help? For example, the vaginal canal, the vaginal epithelium, of course. When we apply just topically the IRLV mixture, we can increase the collagen and the elastin synthesis. So we can improve the extracellular matrix, which is the bed base of that epithelium. So we can improve the bed. So it means we have a structure of a dense extracellular matrix like when we are younger. Like the same with the skin. We have more angiogenesis. So improvement of hydration of that area, which at the same time leads to more hyaluronic acid produced from our fibroblasts. So we can improve the old phenotype of this area, and we can reverse it to a younger version of ourselves. What else? Those exosomes, they've been genotyped and they have significant markers. And for that area, CD44 is very important to be a marker of those exosomes. Why? Because those exosomes, when they are simply applied in the mucosa, they can quickly uptake because CD44 is connected, and then we have an influx of those exosomes to the target cells. And at the same time, we know that when CD44 is expressed from our own fibroblasts in the skin, in the mucosa, then more hyaluronic acid of the one that they produce on their own, it can come inside, so we have more hydration in that area. What about other things? Very important, we know from the studies that as we're getting older, both the skin, both the hair, both the mucosa, what happens is that we increase inflammation, and aging is a chronic latent inflammation. And IRLV has been proved that it can significantly decrease the inflammatory process by ameliorating the inflammatory cells. They are target cells that IRLV can target, and they can harmonize them. What else? In both young and older age, what happens in the skin, what happens in the mucosa is that it gets darker. So we can improve pigmentation by just a topical application of IRLV in the intimate area. And that's very important because it's not just the older age, but also the younger age is caring about the improvement of the pigmentation in that area. It's a beautification. It's an aesthetic improvement of the color of that area. So again, more improvement of the melanin and the excess production, and we can see that in those studies that with just application of the Rosa damascena stem cells exosomes, we can significantly improve the melanin production at the level of the skin and the mucosa. And what are the indications of IRLV in the intimate care? They are both aesthetic, as I said, for hyperpigmentation of all ages, from young to old, of any ethnicity, hyperpigmentation of the external genitalia and dehydrated external genitalia with wrinkles, with loss of volume. What about the functional? So the functional target and applications are the vulvovaginal atrophy and laxity that we can see in that area, the dryness, the itching, the pain, and the low sexual wellness that we can improve in those patients. So we have both aesthetic and functional applications of IRLV. More indications. What about lichen sclerosis? We have multiple cases around the world that lichen sclerosis just nowadays can be improved with IRLV. And by improving lichen sclerosis, which is a chronic irritating condition of that area, we can also improve the fact that those women, they are prone to cancer, because we can have cancer on the top of lichen sclerosis. So by improving lichen sclerosis very quickly with minimal downtime and minimal treatments with IRLV, we can improve significantly the health of that area. Post-surgical healing, Dr. Rashad said that we can improve the healing of any procedure in that area, even just biopsying that area, for example, just to diagnose. And stress urinary incontinence is another symptom that we can improve with IRLV. How we can do that? So, applications of IRLV. We mix the exosomes that they are lyophilized with the dilute, and as we said, we have 2.5 ml of the end mixture, and we can apply it topically in the problem, in the area that is problematic, in the genital area with gentle massage. Where? In the vulva, in the perineal area, in the vaginal canal inside, and we can also dry the area with a fan or a cooling system if we have in our clinic. How we can use it, for example, for pigmentation, for hydration, for aesthetic improvement, or for lichen sclerosis or any other disease, we can use our CO2. Gynecologists, they have been using CO2 inside the vaginal canal and outside in order to improve those conditions. Now we can have less treatments with the same devices, CO2, HIFU, radio frequency. And this is a protocol that we can, for example, the indications of that protocol is that we can improve vulvovaginal atrophy, hyperpigmentation, laxity, loss of lubrication, sexual dysfunction, and mommy makeover. We call it a Femi lift protocol. And with the application of IRLV, we can have less treatments and more longevity, less pain and less downtime to those patients. So what we can do is on the same day, we can use CO2 and HIFU in just one treatment with minimal downtime. And HIFU goes first. It has minimal, the 40% of the treatment, which perhaps is 1 hour, and CO2 second inside the vaginal canal. As soon as we finish the treatment with a combination of HIFU and CO2, we can flush inside 1.5 ml of the mixture of IRLV, and then we can do fractional CO2 very gently and very minimally outside for the external genitalia in order to improve hydration, wrinkles, aesthetic appearance, and pigmentation. And then we apply the rest of 1 ml of the IRLV and gentle massage of the external genitalia. This can be repeated up to 4 times per year and can have a repeat every 6 months in order to maintain the result. What about indications such as stress urinary incontinence, which is very important as we're getting older, and it affects significantly the psychosocial background of our patients, and the vaginal prolapse and the sexual dysfunction. Then again, CO2 and HIFU in one combination, but this time CO2, HIFU can be more aggressive and CO2 less aggressive. But again, in the past, without IRLV, we had more downtime, more side effects from those patients. Now, with just 2.5 ml of the IRLV intracanal, we can have minimal downtime and very quick healing of those patients, significant improvement of the stress urinary incontinence from the first treatment. And of course, CO2 can always be replaced in that area with RF microneedling. Lichen sclerosis, what is the protocol? And what we have seen from all the protocols around the world. So we can use either RF microneedling or fractional CO2, this time in a very lower power setting. So our target here is those devices to be used for just IRLV to enter the problem. So 1.5 ml of the mixture with a gentle massage in the vaginal canal if the patient is suffering there from the lichen sclerosis, and 1 ml for the anogenital skin, just with a gentle massage, just one pass, and we can repeat that 3 to 6 treatments depending on the severity and the chronicity of the problem, spaced apart 1 month. And we can see here a patient that had RF microneedling and IRLV with a lichen sclerosis and with ulcers. We did one treatment and significantly improved. The fact also that she has ulcers in the perineal area, this was the fact that it was more painful for her, with just topical application of IRLV. She improved significantly after a week of the treatment. Another case from a beautiful and very knowledgeable gynecologist, aesthetic gynecologist from Taiwan. She did for hyperpigmentation, fractional CO2, and IRLV, just one treatment in this patient, significant results, as you can see here. And also she used the same process inside the vulva, and she had significant improvement also of the lubrication in this beautiful patient. Another doctor from around the world that she did CO2 and RF laser just with IRLV, one session, significantly improved the hydration, the lubrication of that area, the dryness and the irritation. And another doctor from around the world, again, from the aging, from the perimenopause area, she just used 2 sessions of RF microneedling, spaced apart for a week's time with the topical application of IRLV, and the patient significantly reported that the itching disappeared. Another difficult case of lichen sclerosis, difficult case with the application of IRLV, that the lichen sclerosis completely resolved, and the patient was able again to feel the healthy, the skin in that area healthy again. In conclusions, IRLV significantly improves the symptoms of menopause. and in the intimate area, it induces quick repair. It reduces inflammation. The number of energy-based devices that we need to apply in that area, which is very sensitive and delicate. And of course, it improves pigmentation, hydration, and lubrication without the need of the side effects of oral medications that we have needed in the past to use in those patients. So I should say in those cases, those patients that I have already presented, they were taking in the past HRT. And when they started IRLV, they stopped. And still nowadays, they are free of symptoms without the need of HRT. And that's very important for us. So let's talk also about XL Balm. So XL Balm is the first and unique formula of a post-care cream with Rhododamascena stem cell-derived exosomes in just one mixture for post-care. So it's a beautiful product that we can apply also in the intimate area for healing, for pigmentation, but also for the skin. So we need to know, because it's the first cream all over the world that it has been able to incorporate true lyophilized exosomes in this formula, and it can help us in multiple ways as dermatologists for post-care healing, for problems that we see in the skin like dermatitis, atopic dermatitis, lupus, psoriasis. So we need to know that Exobalm, it consists from the exo capsule, which is a capsule as you see here with rose stem cell derived exosomes, and at the same time they have incorporated growth factors, peptides, and minerals. Why that? Because our exosomes, our own exosomes, they need food, they need energy in order to act. So we have a microenvironment that simulates our exosomes. And at the same time, the cream base, what it has inside, which is very important for the healing of the skin and the improvement of pigmentation, is tranexamic acid, matecosol, panthenol, and niacinamide. All the beautiful products that I need to improve the texture and quality of my skin. All in one thing, all in one mix. There is a mixing balm that I can apply pre my procedure, after my procedure, whenever I want, in order to improve that skin. An open skin, a skin that has undergone surgery, a skin that has undergone energy-based devices or lasers. Exobalm is there to help us. And let's see why we need Exobalm in our clinic and in our post-care treatment. And we know that post-care treatment is very important. What we give to our patients when we perform energy-based devices, when we perform surgery, when we treat the patients that they have old, thin, sensitive skin, which, as we saw in my slides, it looks like a desert. It doesn't have the potential to regenerate. So we need to be very careful of what message we give to those patients during the clinic to regenerate, and after the clinic to continue the correct regeneration of youthfulness and to improve repair. And we know that from the skin that there is a consequence of events when, for example, we do a laser treatment, when we do a scar in our patients. So there's inflammation, proliferation, and remodeling. And when these are in balance, what it can happen, although we think that we created more collagen and elastin in those patients, this can lead to a scar. If the skin is not ready to regenerate, if the skin doesn't have any energy to regenerate, doesn't have any potential. So not all collagen is good. What we need is the right collagen and elastin, the right extracellular matrix in order to have youthful skin and not to have a scar, hypertrophic or hypertrophic with our treatments. And this is what Exobalm is coming, because Exobalm has the potential to improve the healing process, to ameliorate it, whether the skin has energy or not, whether the skin is old or young. Why? Because the rose stem cell-derived exosomes, they have proof that they can be quickly uptaken by the inflammatory cells, the melanocytes, the keratinocytes, the fibroblasts, and it can improve everything, the extracellular matrix, the melanin production, the inflammatory process. And we have also vitro, as we saw, evidence, but also in vivo clinical evidence that it can improve skin health. It can not only improve, for example, melasma, which is an inflammatory process, or post-inflammatory hyperpigmentation, or any form of pigmentation, pigmentation, but it can improve wrinkles, it can improve inflammation, it can improve redness, and this means improvement of skin health. And we have that evidence in the literature, and we have that evidence also from our clinical cases that we see around the world. And this is a pilot study that I did on exobalm. So I had two different men of different ages, of 53 and 57-year-old. So the 53, the younger men, we did a skin biopsy, a punch biopsy, and we didn't do anything. We didn't treat with exobalm. We just treated with the regular things that they are for healing. And then 57-year-old male with exobalm twice daily for a week, with no scar and no pigmentation. So this shows that although we had an older photodamaged skin, we gave exobalm, and the same prick that we induced in the skin, the same damage, the same scar, it quickly improved as if the skin was younger, compared to the younger skin that we didn't give the right message, we didn't give exobalm, so it healed with a scar and pigmentation. This is the potency of exobalm. And this is a protocol that I have devised, and this helps me a lot with photodamaged skin, with sensitive skin, with the intimate area as we're getting older that is more atrophic, more pigmented, with lichen sclerosis, with any kind of inflammation of the skin or the mucosa. So I call it exopriming. Why? Because I give exobalm before, so I give the message to the skin to improve before my treatment. 2 to 4 weeks before my treatment. And then I do my treatment, and I don't hesitate to increase the energy that I need to give to that skin, because this skin has already taken the information from exobalm to improve inflammation, to lower the melanin production, to be more youthful. So I do my treatment in the clinic, I use my IRLV or my AC Plus exosomes, and then I continue with exobalm at home so that I continue the message that I gave in the clinic. So I have quickly youthful skin. That's very important. And we can see this in the following cases. So this is a patient that wants to do around the skin, a very, very significant laser for vessels. And this is aggressive. In the young, it can also take out the fat tissue when we do it around the eyes. So she did the in the young around the eyes for vein laser, for vein removal. And with just the application of exobalm, prior to the treatment and after the treatment, very quickly, we saw zero pain, zero edema, zero erythema, and very important, non-inflammatory pigmentation, and of course, no loss of adipose tissue around the eyes, which is very important when we do those lasers around the eyes for veins and vessels. Another patient with lupus, she did the exopriming protocol. She wanted to improve the skin texture. She had lupus for 18 years and she had stopped medications and she was flushing. She couldn't use even the makeup. It was very itchy and painful. So we started exobalm before dermapen in the clinic because she could not tolerate dermapen. So we did exobalm. Then she did exobalm for 4 weeks on the skin. She felt very nice and ready for the dermapen. We did dermapen with C+ in the clinic, and then we continued exobalm at home. And then she got beautiful results. It was the first time that she could apply makeup, and she's an actress. And at the same time, with only just one treatment of the exopriming, she got significant improvement of her lupus for at least 8 months. And this was very important for her because with medications, she was not able to control the skin problems. Another exopriming case, a severe case of burn after a hair iron. She touched the hair iron on the skin and everything opened. And she was also exposed to the sun, so she was afraid of post-inflammatory hyperpigmentation and scarring. We just applied exobalm for 4 weeks, for a week time before we do any laser. So she quickly healed. Then we did laser for the pigmentation and AC Plus, and then again exobalm, and we got zero post-inflammatory pigmentation, zero pain from the first application of exobalm, and of course a very beautiful healing in that patient. And you see that after a month of the whole treatment. Another patient with jellyfish stinging, she was using cortisone for 1 week time, and she got severe pain, severe swelling, and pigmentation. So we started Exobalm as soon as I saw her after a week of the jelly sting problem. And then with Exobalm, the inflammation reduced. So I saw only the pigmentation. We did Dermapen with AC Plus in the clinic, and then we used the Exobalm, and she got 0 pigmentation after a month's time of just 1 treatment of the exopriming protocol. So the potency of Exobalm is very significant in our treatments. Thank you very much for your attention. I hope you enjoyed. I am ready for questions if you have.
Okay. Thank you for your insightful lecture, Dr. Elina. It was very impressive. So we have questions for you from the audience. The first question is, can Exobalm apply to the inner vagina? If so, can it apply alone without doing any laser?
For the vaginal canal, I wouldn't recommend because it's very thick, but for the external genitalia, the pigmentation of that area, I would apply post-care. We have a beautiful feedback from especially the peri and postmenopausal patients that they feel dry that area. For younger patients, I would be a little bit careful because it's a thick product. But for the peri and postmenopausal patients that they're very dry over there, I would definitely apply post-care.
So the second question is how to use IRLV through mesotherapy, microneedling, injection, or direct application like Essence. Which one is more recommended for you?
So perfect question. So at the moment, the exosomes that we're talking about with regards to any exosomal product, the approval is only topical application. So today we will be discussing about on-label study, the on-label application. So the on-label application is direct topical application in the area that you will be treating in the clinic. But for example, if you have a burn, if you have irritation in that area, in the vaginal canal, in the vagina, in the vulva, in the anogenital region, then you can just apply it topical. You don't need to do any energy-based device. But if your plan is to modify the area, to improve pigmentation, to improve hydration, vulvovaginal atrophy, so you will need an energy-based device, as I have discussed already with my protocols, in order to have a synergy of the energy-based device in that area. So you can use RF microneedling, just microneedling. If you want to modify for pigmentation, the non-thermal, it's only for outside external genitalia, not for inside the vaginal canal. CO2 and HIFU. So you can use those modalities to get the benefit of those modalities. But those modalities alone, they can have side effects or they can have significant downtime. So if you combine with the IRLV, flashed topical inside the vaginal canal, then you have minimal downtime from your treatments. Again, if you can just apply topical after your energy-based devices and lasers on the area that you treated for any indications that you want, again, modification, wrinkles, hydration, lichen sclerosis, pigmentation, all these are indications that you can use. Then just topical application after your energy-based devices, and that's it. But as I said, if you have an irritation, as Dr. Rashad showed, this beautiful case, then you can just apply it topical in the irritated area, in the ulcers that you will be having. And the idea is that it will significantly improve the irritation because it lowers the inflammation. It can improve the way that this area is going to heal because it's going to improve the extracellular matrix. So you have multiple benefits just from the topical application. You don't need to inject.
Thank you, Dr. Elina. So you could feel free to leave the meeting if you have other schedule. Okay.
Thank you very much. Thank you.
Yes, let us welcome our last speaker, Dr. Grace, a gynecologist from Taiwan. Dr. Grace, please share your slides. Dr. Grace, would you please share your slides?
Yes, okay. Yeah. Sorry.
Great.
Okay, just a second. So just, okay. Okay. Sorry, I think it's So should I just start or? Okay. Okay, hi everybody, I'm Dr. Grace. I'm very happy to be here today, and I'm a gynecologist, and in the back there's gonna be a little bit of information about myself. So I'm here today to share my some experiences of using IRLV towards internet rejuvenation. Okay, let's see. Oh, sorry. Okay. And this is a little background about myself. And on the bottom, the QR codes are for my social media. So if any of you guys want to stay in touch, feel free to swipe your little fingers and add me and stay in contact. Aside from that, I'm a gynecologist, and I'm a full-time right now doing gyno cosmetics. So towards females with genital problems, not just clinically with our common clinical problems, but also for aesthetic-wise and also female well-being. So this is what our main focus is right now. Scroll. Okay, sorry. Okay, sorry, my PowerPoint is still acting up. So so this is a little brief outline of what we're going to talk about today. So the first topic is the women wellness and also the rising intimate market. And the second part is how to treat these people with intimate problems. How do we care for them? And also the role of tonight's highlight is also our IRLV. What's the problems that it can solve and provide for these patients with our exosome. And last but not least is my clinical experiences and also some cases that I like to show you guys. Okay. Sorry. Oh, okay. Sorry. Okay. Okay. So through the process of growing up, we face many changes. From a little girl, we grow into woman, into mother, into menopause, and then we gradually age. But through every stages in life, women face a lot of problems and changes. But despite all that, I myself as a woman, I'm still very proud to say that I'm proud to be a woman. And at the same time, I can also provide help for these women down the road of aging, because it is something that all of us will face during the process of growing up. I'm sorry. Sorry, this is PowerPoint acting up. So just like a fresh peach, when we're just kids, when we're at youthful age as a little toddler, our genital areas are just like a very pulpy, fresh peach. And through the process of aging, we start to wither, we start to lose the volume, elasticity, lubrication. And at some point in time, when we go through menopause, we're going to just wither away. So this is the hard truth for the process of aging. More than 90% of female, and I'm sure any of the audience that are listening right now, and also myself, I've had gynecological related problems. So all of us have had the same problems. But what are these problems? They can be as minor as shapes, discharge. It could be from the parents' pulpiness, odor, to big as sexual dysfunction, having problems, having intercourse, dysmenorrhea, all sorts. The list goes on and on and on. But even with the minor, most minimal problems can cause tremendous impact on women. And because I have shifted my main focus over to gyno cosmetic market, I've noticed a very interesting trend throughout the years, especially in the Asian market. Through the past 3 to 5 years, there is a gradual increase, and it's rising at the same time along with a women's wellness awareness, because people are starting to care more and more, not just about what they see on the outside, just the first space we see in the mirror, but also what's more important on the inside, because we want to feel healthy from the inside out. It's not just about beauty anymore, but it's like the well-being. So we start to notice more and more women are stepping into my clinic, asking to seek for, not just because, oh, I'm sick. No, it's because I want prevention. I want to look prettier on the outside and feel prettier. So when I am treating each and one of my patients, I'm always wagering between the two, the functional problem and the aesthetic problems. And over the past, patients would come in not certain of what they want to do, but nowadays I think it's a 50-50 ground. So a lot of people care about functional, and that is the main cause of a lot of problems that may elaborate into the further down the road problems. But the thing is, aesthetic also plays just as equivalent role in the market itself. So when we're talking about functional problems, I'm not going to go through very deep in this, because I'm sure the previous speakers have gone through all of this, but basically we categorize. So a lot of problems come from aging, infection, sexual intercourse, and urinary incontinence. So these are the problems we commonly face when we face functional problems. But we're going to shift to the other side, where we see intimate aesthetics. Okay, so this is my main focus and what I do every day in my office. So intimate aesthetics, people tend to think it's just what you see. Oh, no, no, no. It's not just what you see. When we talk about intimate aesthetic, it's a variety from the inside to the outside, okay? It's from the inside out. So in the past, people would care about just perhaps appearance-wise, or just because of menopause, we have some discomfort from dryness. But now it's what the eyes see and what we feel and what our couples, where your partner feels at the same time. So what do we do? Patients come in my clinic wondering, what do I do for my intimate areas? Is it the shapes, colors, textures, tightness? Oh, all the above. But most importantly, I think it's the balance between the five. So we see this pentagon, right? The pentagon, what it's trying to show is that a lot of times in our bodies, it's a combination of any part of the body. It's always, whether it be hormones, it be factors, it be secretion, all these are based on equality. So when you lose the equality between the two, it's a balance, whether it be tightness, root gain, mucosal integrity, lubrication, elasticity. When you lose the balance between the five, you're going to have problems. Your problem is, and that's what we usually commonly treat. But aside from that, we also treat what we call the outside is what we see. So patients come in wanting, I want to look pretty. So what is looking pretty is our aim. So what do? Patients come in, and this is a combination of what I receive from our patient, what they often request for. I want a little or minimal pubic hair with peachy pink look, with minimal labia minora. At the same time, I want a pulpy, peachy looking labia majora and reductive clitoral hood for sexual sensations. But all of these is probably 90% of what one wants for look-wise. Okay. First of all, I am not a pervert, okay? These are real life photos that my patients send me, okay? So just like we want to do a face makeover, we want to do a vaginal makeover. So what they do is they bring photos of ideal genital areas, of beautiful, good-looking genital areas into my office, wanting to look like this. And what do we get from this? From all the above. The appearance-wise, less hair, pulpy look, small clitoral, reductive clitoral hood, minimal minora. So all of these are showing what? This is what we appear to be pretty for most women. So this is what we're working towards. And is it really that important? Well, to me, I think it is becoming more and more important. And why is that? Because let's Google it. We type in these terminology we see, I commonly see these days, like what I want a slit, I want a line, I want a youthful look, camel toe, Barbie doll, like all these terminology. What does it tell us? People are becoming more and more aware to extent that we're having terms and vocabularies to describe our female genital area. So obviously that proves to us there is people actually Googling online wanting to look like this. So this is also another point that is pointing out that this is becoming the big market throughout the years. And this itself is one of my personal favorite pieces of artwork. It's by Jamie McCartney. Off the bat, when a lot of people see this, what's going to happen is they're going to, oh, it's trying to define whether a woman is pretty or not. Oh, we're trying to, from the looks, it's not as pulpy, it's wrinkly, it's too long, ripples. No, no, no. The message behind this photo is actually direct opposite. What the artist is trying to convey is that women should learn to embrace themselves. It's a combination of over 100 female genital casting. So it's lined up. It's called the Great Wall of Vulva. So I personally like this is because that is the message I convey to my patients. There is no beautiful or the perfect or the ideal. It is what you like. So it's always what I tell my patients. Love who you are and embrace yourself for what you are. Okay. So I'm often asked, my male patients too, and my friends too, and a lot of patients that come in, why am I doing all this? Why are women seeking for intimate treatments? Is it for love? I'm sure it is. Is it for life equality? For sex? Probably. For health, of course. But for me, all the above, but most importantly, for self-esteem. Because a lot of women, we tend to lose our position after we become different stages in life, where we talked about in the previous, at the beginning. We change through different phases in life, but then we tend to lose ourselves. So finding that self-esteem is very important for a lot of women. So I like to categorize my patients into 4 big groups. So there's the sexually active ones. And first of all, I gotta stress, sexually active does not mean young women, because a lot of women nowadays, because cultural differences and whatnot, more and more women are very, very focused on sexual life. It's not just a young people thing. So sexually active is just a term to categorize them, but it's not young people only. And the 2 big group is the postpartum and the menopause, and the general group with women with general gynecological problems. And why do we categorize them? Because that way we can kind of give them a briefing of all the treatments and problems they probably face. And I'm sure this probably a lot of you have heard, so we're just quickly go through them. This is how I categorize my patients and give them sort of treatments they require. So sexually active, I'm pretty sure it's going to be infection, so on. And postpartum, so most mommies come in wet loosening. I have sexual desire problems, so I want to improve on that. And of course, with infection, all the other possible problems we see in a woman. And then a lot of young women coming in for what UTIs, general gynecological problems. But another thing I really noticed over the years is very interesting is that there are more and more young women coming in right now, which is very good. For me, I think it's a good sign. So it's a two ends. In the past, people step into your office mostly looking for treatment for their problems like I have vaginitis, I have a lot of discharge, I have itchiness. But these women, for young patients, I have patients young as 17 coming in, telling me, I don't look pretty, I don't feel pretty. Can I look pretty? Oh, first of all, no. You're underage. But the thing is, you start to notice the trend that more and more young people are caring about what they look, how they feel. They want to not just look pretty, but want to feel pretty. And at the same time, you see older women coming in. These women are, especially in Asia, it is not typical women you would see that will step into your office. Not unless she's literally, on her deathbed, because genital area is a very, very confined and very closed off market, especially in the Asian market. But these women are willing to step into your office and tell you everything from their sexual life to what is affecting their daily life, all up until like, I can't have leaking problems. I can't go out in public. I can't make friends. But this is why I categorize them, because you'll notice there are common problems these different age groups will encounter. But you also notice, because of categorizing, you notice these trends as changing over the years, and women are becoming more and more aware of what is wrong, and they're seeking for help. Because in the past, they may be just locked in their rooms, Googling online. But nowadays, they're willing to step out of their room, come into your office and tell you your story. And you'd be surprised with all the stories that we hear. In the back, I'll be sharing some of the cases with you guys. So menopause is a very big field for us in the future, and I'm sure globally, because we are all an aging country. So enough of the category, we're going to move on to treatment, which is also a main factor. So I'm sure I'm not going to bore you guys with all the treatment methods, but in general, we divide it into three. So there's going to be the non-invasive ones, minimal, and also invasive ones. And I'm often asked, which is better? Honestly, there is not a better one. It's actually a combination of therapy. It's using the right equipment and treatments for a specific problem. But there is never just one problem and one solution when it comes to genital areas. All right, so non-invasive ones we're not too unfamiliar. So all the laser, RF, all these treatments are good for general problems. But then we move on. When you have more problems and you have more requests, then we go on to minimal invasive. So these are all the fillers, collagen stimulants, PRP, PLT, and what we also use, the highlight of tonight is IRLV exosome also falls in this category, whether it be application or it be injection-wise. And last but not least is my personal favorite is invasive ones. It's not that I like to chop my patients up. No, it's my favorite because a lot of problems, it can't be done or it can't be reached with just minimal or minimal invasive, because there are problems you need to have surgical treatments, but it's actually a combination that makes it even better. All right, so like I said, in Asia, it's popular for most people to want to come in for non-invasive ones, hoping to get a surgical result, but that doesn't work. So you need to let your patients know there are boundaries, but it is us as medical personnel and a gynecologist, we should tell our patients what we can do and what we can provide, because these patients, they have no idea. All they know is probably this will make it better, but the thing is they don't want surgery. But sometimes surgery is inevitable, and this is where communication in our aspect, doing gynecosmetic consulting and also knowing your patient's problem is the number one utmost important thing. So when I go through consultation, I spend hours talking to my patients. You'd be surprised I come out knowing how many dogs they have at home and who they're having an affair with, because that's how detailed we go in, because that's how you know your patient's problems. But in order to give them a good treatment, you have to understand your patient's problems. And this is a very important factor, because clinically, not just in the field of gynecosmetic, but in every field, we're always looking for a win-win. What's better for the patients and what can we provide? And in my aspect, we've always been seeking for perhaps an item, a product, a machine that can provide these patients with perhaps, excessive treatments where they come in and they get one treatment and it's like, bam, it's so well. But I mean, we've been looking, but so far in the past, we've always been making changes here and there. But now, on the other hand, perhaps we found the perfect combination. So like I said, it is always about combinational therapy, pulse therapy. It is not one problem, one solution. So I'm very happy to announce in the summer of 2024, the world's first intimate exosome has launched, also known as IRLV. So this is the highlight of tonight. This is one of my personal favorite products over the past 6 months or so. So I'm sure in the front, all the speakers have said it. So it basically what it does for the genital area. So for the inflammation, for anti-rejuvenation, anti-aging. So these are key factors. Why? Because that's the process of aging. This is the problems all women are going to face at some point. So what it does is histology. I'm sure last speaker has spoken a lot about it. So it basically strengthens, and because of the elasticity, the volume, the thickness, it will help women to feel better. And we do see all the problems will make women feel not just physically, but also mentally, they feel well. So the treatment itself is recommended probably 2 to 3 times a month, but it varies with the different patients. So that's why consultation in our aspect is very important, because it is not something where your eyes see, but what your patients tell you. So in short, what does the exosome provide? In the bottom, collagen stimulation, regulates pH, vessel growth, and then anti-inflammation, and regulates your hormones. So these are all the problems at some point. If you're a girl watching our seminar right now, you will at some point, perhaps not now, but you will definitely face this problem. I'm sorry, this is supposed to be animation, but my PowerPoint is acting up. But what I'd like to say is, to me, because exosome right now, IRLV, it's not solo, so it needs to be combined with our other therapy that we have right now. But like I said, we're looking for that booster. And apparently, IRLV right now, it is that booster. So for every treatment from microneedling to RF to surgical to fillers, all these I like to apply, or even just after intercourse, you have slight laceration. They act as a booster for each and one of our treatment. Not only shortens, but it strengthens my treatment. And over the 6 months, I've been doing some clinical studies and sorry, statistical data with ExoBio. So over the 6 months or so, I've actually been able to collect 76 patients. Oh, sorry, I'm correct, 78 patients. Oh, sorry, 76. My bad. 76 patients. So all these patients with above problems, so they've come in for one treatment only, along with perhaps what they need. I'm not sure. It's depending on each patient. I evaluate them, and then they report it after 1 week and 1 month after post-treatment, and this is the feedback they gave us. So all these symptoms and signs over the week and over the month, there is a gradual improvement in the first week and more over the next month. So in the end, we can see that with the help of exosome, it has acted as a booster, and patients are more than happy with the results. So, and we're still following up on a lot of these patients. They're coming for second and third treatment. So we're going to continue the study with ExoBio and hoping to have more and more promising results. All right. And really big factor in our aspect of the field is becoming close with your patient, because in order to know their problem, you have to be close. And I'm very happy to have welcomed this. This is my patient, and she's not shy, so I'm very thankful she actually shared this video with us. So this is a little speech she had. She recorded for us after using IRLV. Sorry, let's just play this really quick. Okay.
Dr. Grace, we cannot see the video.
Oh, you can't see the video? Oh my God, hold on. Because I was trying to see because it's running on my side. Let me see. Okay. No, it's not working. Okay. Honey. All right, okay, I'm sorry. Okay. I think I don't know if it's Okay, sorry, it's not, I think it's acting up. I'm sorry I can't see the video, but I'm more than happy to show them at the end if it's working again. But I'm sure there's more stuff you guys want to see in the back. I have cases that I want to show you guys. So I'm sorry, I'm just gonna have to skip over that because I don't know if it's my computer or it's just not working too great. Okay, sorry. So right after that, so what we like to focus on is right now for gynecosmetics field, where we're doing right now, what we provide here is one-on-one consultation and also privacy and also the newest equipments. And what are these for? These are for evaluating each one of our patients. So know their problems, seeing what their mucosa looks like, and also most important is knowing your patient's stories, because it's not like you have something on your skin, you have something on your tummy. It's not something you can just look and see. It's what's on the inside it's causing the problems, and also what is their life like. I mean, their partners, could it be other partners? It could be. So a lot of these times, being able to step into your patient's world is very important. So consultation for us is very the utmost important thing for each consultation and for us to get a promising result after. So the next part is where I'm going to show some of my clinical cases after using IRLV treatment. So there's some surgical and there's some non-invasive and minimal invasive. All right, so okay. Is this going to work? I'm going to click this in. Okay, so this is a young woman. She's 21 years old. So people are thinking, what problems are you having with 21? But obviously you can see, because lichen sclerosis is not as common as it is in Asian people, but it's still a lot of itching problems due to our climate. So she has a lot of hyperpigmentation on the inner side of her folds in between the labia majora and minora. So what happened was she wasn't sure what happened. She told me her vagina looked like a pair of stairs where she could step in. So she cared about the volume loss and the laxity and also, of course, the pigmentation. So what we did is we gave her treatment of CO2 laser for abrasion and also a little bit for the pigmentation. And we applied IRLV topically post-treatment and just massage it thoroughly. And this is post-treatment. Okay, 1 second. This is working here. Okay, hold on. Is it working? No. It's supposed to pop. No, okay, sorry. Okay, sorry. I know. Okay. And then this is what it looks like post-treatment. And then this is what it looked like right after. This is I'm sorry. This is before, and then the middle one. This is right after the treatment, and then this is after we applied IRLV in a week after when she came back. So she was very pleased, but she's still coming in for treatments because she wanted to be peachy pink, like we said. That is her aim, and that is what she wants. So we're gonna do a few more treatments, and I'm sure the results up until now are pretty promising. The second case, this is a postpartum mommy, and then she has, obviously you can see she has a very big labia minora, and she came in because she has volume loss and she doesn't feel pretty. And she wants that 2 wings off of her. So we did a labia plasty for her minora, and we did fat graft for the volume loss. And after post-treatment, we applied IRLV right on the top of the area. So this is right after excision. And then we applied fat graft, and this is 1 week post-treatment. And I was actually pretty surprised with the results, because usually post-treatment, especially for patients that come for fat graft, and for some listeners that are doing some surgical treatments for fat grafts, because we have to overcorrect first, because most of roughly about 50% of the fat's going to be absorbed. So through that process, there's going to be excessive extension of the skin. So when we come back a week after, a lot of times you see like the skin is very thin. Sometimes the healing might not really be fully healed yet, but this patient came in exactly 7 days, and you can see the tissue has literally just grew over, and it's not too red, and you feel the texture. I mean, there's a thickness. So I was actually pretty shocked with the results, and obviously the patient felt minimal pain, and she was very happy with the results as well. And this next one, and this is the postpartum mom. So she's having problems. She doesn't feel sexy. And because her kids are older now, they're off to school. So she wants to have intimate moments with her husband, but she's having a major problem because, as you can see, there's an eversion of her opening. So then when she wears tights or anything down to just even a tea bag, she can't even go out of the house like that because it rubs and it's painful, and there'd be an infection afterwards. So for her, it was a laxity and also the volume loss. But this patient, she does not want surgical treatments. So then we lined her up for a form of retreatment, and I told her there may be a second treatment because of her clinical problems, and it can't be done with 1 treatment. So once again, being able to tell your patient what she needs, because she doesn't know what she needs. What she needs right now is help, and she has problems. So we have to be here to solve her problem. So she needs to know 1 treatment might not be enough for her because she actually needs surgical treatments. But I always respect my patients. Only do the ones you can accept yourself when. I mean, if you don't want surgical, it's perfectly fine, but there are things that you can't do. And then we did filler on bilateral sides along with CO2 laser for the inner vaginal wall and also for pigmentation. And then post-treatment, this is what she looked like right after treatment. And when she woke up from going under, she was so happy. And she's like, I feel sexy already. Just for that compliment, I mean, that feedback, I was really happy. And after she came back, roughly about 3 weeks or so, and she was more than happy, and her husband came along with a big grin on his face. So I'm pretty sure they're happy. So this is what we need to know about your patient's problems and what we can do to help them. All right, this is a young patient, okay? What our problem is, as you can see, there's redness, and you can probably guess is very itchy. And for her, it's more cosmetic concerns. And because now she has a new job, she's an accountant, so she has long hours on seat. So as we all know, on long hours of sitting on your buttocks, it is high pressure and the circulation is really bad. And because she has very, very full labia majora, that is a problem. So she's had itchiness, swelling, and she had even blisters from excessive scratching, and it's dry after, and an on infection. So she came in, first thing she did, we did labiaplasty, and then she wants more sexual desire. So we did a clitoral reduction. And then post-treatment, we applied IRLV for the surgical treatment and also for that redness and inflammatory response on the topical skin. And this is what happened after. This is 1 week post-surgery and post-application IRLV. So as you can see, we literally didn't do anything on the outside. She didn't do any laser. So she did was application of IRLV itself. And just look at the skin color, the swelling and the redness. But she also did surgery, keep that in mind. She did excision, and the skin looks better already. And she says herself she feels better, even though she's sitting out for long hours too, but she doesn't feel that throbbing when there's vessels going through when she's sitting down, which is very, very encouraging for us. And yeah, she's still coming back for further treatments. And also there's also adjustments for her life for the way she sits too. And that will also help. All right, this next one is this is a postpartum mommy, but she had a lot of volume loss after she had kids, and she lost roughly about 50 pounds. And this is what happened to her labia majora. So she feels unsexy. She doesn't feel very feminine. So she wanted to look pretty again. So she came in. So we did a labiaplasty for her majora, and also for the hyperpigmentation, and also a sexual desire. So we did a clitoral hood reduction. And this is what she looked like. This is roughly about 10 days. I remember around 10 days. And this is what she looked like. For some people, if you guys know, if you do labia majora, what happens is the excision that we make is going to be on normal skin. It's not just the mucosa itself. So the healing time takes even longer, because even just walking, it will tug on your scar and the patient will feel pain. So I was shocked with this results because it's only been 10 days. A lot of my patients come in on week 2 and the wound is still very thin, but this is only 10 days and there's a thick tissue that's grown over. And of course, she feels sexy already. I told her the swelling hasn't gone down yet, but she's like, I'm already feeling sexy already. So all these feedbacks and patients, how they feel after is very important, because that's stepping into your patient's world, knowing her problems. So with this volume, she's very happy. She's very happy. And then the pinkness started to go away with, I remember, second or third treatment. Okay, so this is another patient. Okay, this is a young patient, but she had a child when she was very young. So as you can see, there's a natural delivery scar, but she's still young. So I remember she's 25. So she had a kid when she was like 16. So she wants to feel sexy, and she's still young. She's still young. So all her major concern was she wants to feel sexy at the same time, and she wants more sexual desire. So we did a labiaplasty for her majora, and because there's volume loss, and then we did a fat graft on the bilateral majora area, and then we did laser for the inside and out for the pigmentation and elasticity on the inside. And this is what she looked like. This, I believe, was like about 2 weeks after her treatment. 2 weeks after her treatment. And on the outside, as you can see, the pigmentation and the wound has healed beautifully, and the color. She's very pleased. And notice on the bottom, the NSD scar, post delivery scar, has lightened a lot, and she feels great. She feels great. Okay. So I have a few more cases. I'm going to run through them really quick, and then this patient, she's a menopause patient. And for her, she was very happy because she told me I was her lifesaver. I was very happy with that because she had problems. As you can see, there's eversion, volume loss, but her problem is she doesn't even have to go through intercourse. She wants to feel young and be able to be with her partner again. But the thing is, she can't even go through a day without bleeding on the bottom because it just hurts just when she jogs. So for her, volume is a big problem, and also the hormonal imbalance is also a big problem. Okay, so what we did is we did laser treatment because she didn't want surgical treatments, and we did laser along with Forma V and also IRLV on both sides. But this time we did it with not only topical application, we did a little bit of injection on the outside, and then this is the result right after treatment. And so you can still a little bit of redness from the Forma V, but the tightening when the patient woke up, she's wow. I didn't even remember me being so tight when I was young too. So patient is very happy, and she's still constantly coming back for treatments. All right, now this is a young female. Now this one, the result of this patient, I was shocked because that was more like a trial. So I had to agree with her patient, and because she's actually a friend of friends. So then I stepped in and I asked, okay, right now I asked her what happened. She did a very common procedure called hair removal laser. And it was her first time because she's in the past, she's been doing waxing. But then she felt like, you know what, I'm going to step into the field of laser. And then this is what she looked like 3 days after her treatment, and she was through the roof. So she came in asking, and when she came to me, it was about 5 days or so. And I told her, what did you do? There was literally 2nd-degree burn, and there's a scar, and it's painful, and there's infection already. I told her, she just asked me what I can do for her. I said, at this point, nothing. But then I remember we have IRLV. So I asked her if she's okay with trialing her. And she said, it's perfectly fine, whatever works right now, because she had tears in her eyes, thinking I'm going to look like this forever. So I applied only IRLV on the topical area, and this is what she looked like a week after. But during that week, 2nd week, she looked, this is 2nd week. In the 1st week, we did another application on 2nd week. We did CO2 laser to do abrasion on the inside because the infection was better, but there was still a lot of discharge. And this was after 2 treatments of IRV, and the skin looked beautiful. I was shocked that there was no even pigmentation. So the patient is now regular patient here doing laser treatment for her vaginal areas, but she was astonished. I was astonished too. Look at the skin, it glowed. It's even more prettier than it was before. All right, this is another young patient, 20-year-old female. Okay, she came in for treatment, and I don't know if it is popular elsewhere, but in Taiwan, it's almost like tattoo. But it's like, not tattoo, I'm sorry. It's like chemical peeling. So what we do, because Asians, we have more pigmented skin, so they want to look peachy pink. So they go in for a sort of chemical peeling, and what it does, it makes you pink. And obviously it's pink, but not from the peachy peeling, but from infection. So she, again, had a chemical burn. She came in on day 3. She was in tremendous pain, and she's like, I've never had a baby, but I bet it's painful, more painful than baby. So she came in walking with her legs open. And then I told her, okay, we're going to try this again. So I applied IRLV directly on labia majora where it looked like it's already burnt. It's already burnt. And then this is what she looked like 1 week after she came back. And there was no other treatments with anything else, but only IRLV. And just look at how the skin has healed beautifully. The wrinkles and the texture, you can see on the left, just touching itself, it's like rhino skin. It's so firm, and on the bottom, it's basically just fibrosis. You can feel it. And I told her, I can't guarantee you, but we'll try. And she came in tears, but these were tears of joy. So I'm very, very happy with the result, and I'm sure she is too. All right, another young female, sexually active. So this is what she came in looking like, wow. And you're still having intercourse? Okay, this looks painful. I mean, if I were you, I wouldn't want that. I mean, there's laceration on the bottom. There's basically mucosal lacerations everywhere, but she's still having intercourse. I know you can imagine how badly it's infected, but she's still having intercourse. And I asked her, has it always been like this? She's like, from her memory, when she first had her first menstruation, it's been like that. And then she's always getting infections. But the bigger problem is when she started having sexual intercourse, and it's always like this. She didn't know. It was not supposed to be painful. I was like, what? So we did treatments of IRLV, again, just on the topical area, because as you can tell, we can't treat her or anything else at the moment. So this is what she looked like 5 days after. 5 days, just application IRLV, nothing else. And she was like, wow. And then she still came in. She's still currently treating at my clinic. So now she comes back, she tells me, I have never knew that having sex, it could do just happiness and no pain. I'm like, oh, okay, that's usually what it happens. So as you can see, the bottom, the mucosal walls are thickened. And then she came in for more treatments where I did injections right underneath, and it has thickened tremendously. And then she's very happy. She's enjoying her sex life very happily right now. All right, this patient I became very close friends with. She came in post, definitely, she's premenopause, but she's had this appearance for about, she said roughly 10 to 15 years. She can't remember what she looked like before, but she remember it wasn't that wrinkly. So she had a major volume loss after her baby, her 2nd baby, but she also lost a lot of weight. So as you can see, there's a laxity of labia majora, and there's a crazy bleaching down the middle, and the skin is too much. So I asked her, you need to have a labiaplasty for the majority and also fat graft. She agreed, and I told her this was a lot of excessive skin that's going to be taken out. Your healing time may take a little longer, but to my surprise, it didn't take as long as I thought. This is 1 month after treatment, and this is what she looked like. She was so happy. She's like, oh my God, I am so happy. She said she would go home now and she would take the mirror and look at her genital area. Just awing. She thinks she looks beautiful. And her husband is very pleased, and she feels very beautiful from the inside out. And she said she's never felt this young before. But to me, there was still a little bit that I didn't like was of the peachy color of the skin. But this is only a week. 2 weeks after. So she still has IRLV treatments where she applied topical, and then the scarring is becoming less and less prominent. So I'm guessing the results are very promising. I think we're about to the end. Okay, just a few more cases. So this patient, almost like lichenosis, but again, in Asians, it's not as common, but as you can see, that is from excessive scratching. So through scratching, what happens is you lose volume. So it looks very wrinkled, but she's only 38. So she's like, only request I have right now, I just want to feel pretty and I want to have sex with the lights on. So to her, I mean, sex drive is one thing, but she feels so low on her self-esteem. So what we did is we did labia withdrawal reduction along with that graft because she needs that volume and direct application IRLV post-treatment. And this is what she looked like post-op. And then this is what she looked like 1 month after. And she feels, she was so happy. And I remember this patient because she said, I was a lifesaver again. But the thing is, she felt very happy because in Asian families, going to a gynecologist is not the first resort for a lot of problems. So when she told her mother, when she was roughly about 25, she told her mom, I have problems. I have itchiness on my crotch areas. Her mother was like, are you crazy? Do you know how old you are? You have never even had any like sexual intercourse. Don't go to a gynecologist. So her family didn't understand what she was going through, but she had problems. So for me, I listened to her problems and I gave her a solution. Perhaps not up until now, I mean, she's still coming in for treatments. We became very close because you brought that bond between the two. And that's how you hear your problems, your patient's problems, to provide them with the best treatment. Okay, so in the end, I kept stressing in this field what we're doing called gynecosmetic is not what we want. Perhaps we think what is better for the patient. I always tell my patient, oh, fat graft would do better for you. But she's like, I can't. I'm so scared. I'm in fear of surgery. Don't ever push your patients because the result will never be as good when you force your patients. So it is about what she wants, what your patient wants, not what you want. So that is very crucial in our field. In the end, one of a quote I like myself is that one is not born, but rather becomes a woman. And I thank you everybody for your time. And I hope you're very proud to be a woman like me. And then again, on the bottom is my QR code. So for those of you that missed me in the front, you can swipe these and you can follow me. If you have any further questions or want to stay in contact, please feel free. And if you have any questions or any, aside from more cases, feel free to do that. And that'll be all. Thank you everybody for your attention. And it's our little group. Yes, we just had a little get together before our post-training series. So thank you.
Okay, thank you, Dr. Grace, for sharing your valuable expertise with us. So we have some audience questions for you.
Okay,
The first one is, do you apply IRLV at a clinic or do you give medicine to patients to apply at home? What is the interval between the first and second session?
Oh, okay. First things first, because in Taiwan, it's categorized, it's still, even though it's cosmetic-wise, but you do not let your patients bring your product home. Even if there's leftovers, I tell her you don't drink it. No, I'm just kidding. No, you just use it all up because first of all, it's viability is because it's live. So you don't let the patients take it home. We only have the balms that you take home for application for your skin, but you do not let your patients take the product itself for injection home. So what we do is we apply it here, and then because you massage it out, in the end, it will all be used up. So the interval is roughly about at least 3 to 4 weeks before, like patients with special circumstances, like they have burns, those I get them to come back 3 to 5 days. But I usually, the closest interval I've ever applied was a 3-day interval on that patient with that burn, laser burn, second-degree burn. I applied the second application, roughly only about 5 days. 3rd day she came in, I wanted to do it, but then I also wanted to have a little CO2 intervention. So I waited for about 6 days to do it because it would work better. I mean, because of the mucosa nature itself, it absorbs really quick, but I know with micro lesions, it will do a better job. But for her, I think she needs a quick absorption of the product and she's young. So, and it did a great job. So first thing, we do not let the patients bring the products home. So even though it's very simple, but for us, it has to be done in the clinic. So for those of you who want things for your face, you can go for the balm ones. But also when you mix it together, you have to use it up I believe 2 weeks or so, because the viability is the best during that time.
Okay, so the last question is, how would the wound healing and skin rejuvenation result of exosomes differ from PDRN in your opinion?
Well, first thing is very fast. And also, it's a one pulse therapy. See, the patients that I applied on was a one-time thing, but for previous treatments, I guess it's the density and also how it's very rich, and also it's very impact, and it's also because it's exosome. The healing itself is like a precursor cell. So I think the rejuvenating, also the regeneration of skin itself is very, very strong as opposed to other treatments. Because I've actually applied it on myself. I've done it before because I myself, I have problems with that too. So as we age, we face similar problems. So I applied it on myself, and I was actually pretty shocked with the results, because usually I would use ointments for maybe perhaps like a week or so and I feel better. But then I applied it for myself right after my menstruation, and then it gave pretty good results. And I think I was just applying it 3 days or so, just topically, and then it felt great. So what I like to do is before I apply on my patients, I like to try on myself, because I want to know what it's like to go through that day 1, day 2, day 3, and you just watch your skin grow. It's actually quite interesting, because I've done a lot of other treatments for my genital areas, not just appearance wise, but so far the results for me myself is very promising. And after applying it on my patients, and also a few injections itself too, and it actually works even better if you inject it, because it's very localized. So depending on the patients, we pick a variety of things, and also on the patient's budgets. So that's another big factor. So we decided either or I try to tell my patients, we use the exosome, the IRLV, on your biggest concern, and then we use the other products elsewhere. And the results were still very promising. And I gotta say, so far, I mean, it's been performing pretty well. So I'm still doing a lot of clinical trials on my patients, and I'm looking forward to even more and more promising results.
Thank you, Dr. Grace. Please feel free to leave the webinar. So
Okay, thank you.
concludes to our webinar. I would like to sincerely thank all of our speakers for sharing their valuable time and expertise, and our audience for spending your evening with us. So we also have a special event for IRLV on March 8th, International Women's Day, and we will share the details shortly. Please contact our local distributor for more information, and we look forward to seeing you at our next webinar, and hopefully at KIMES and ANWC Monaco. For updates on ESCO Bio's activities, please follow our official Instagram, and have a good day, and thank you. Bye-bye.